So tonight wraps up all of our education events for the month of May. So it's hard to believe that we are already approaching June. If you haven't connected with us throughout, we've had a lot of great education segments. So I'll be sure to put in the link to our video library so you can view all of our amazing topics. I want to remind everyone to keep yourself on mute. And again, we'll be utilizing that chat quite a bit through the segment, and then we'll have time for questions at the end once Kevin is finished with his presentation. He's got a lot to cover, but also a lot of time for discussion. Before we move any further, of course, I want to give a very warm thanks to our education sponsors. So we continue to bring really important discussions like this evening as a result of the support from so many. So tonight's education event presented by UFH Connect is with the support from West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from our gold sponsors, Pfizer, GSK, and Daiichi Sankyo, plus additional support from AbbVie, Agendia, and Tercera Therapeutics. So we are so grateful for all of their support for building out this incredible education library, and it does not stop this evening. So little teaser of what we have coming ahead. So we love June. We love summer, and hopefully, as June approaches, it is a reminder that we have summer sips coming to you. And at the beginning of June, our entire dietitian team will be coming to you with our Cooking Methods 101 and also kicking off our Summer Sips series. So this is each month, June, July, and August, we will be featuring a zero-proof mocktail. We know there's a lot of imbibing and celebrating, and we want to support those and support the initiative to consume less alcohol. So we've got lots of great summer sips coming your way. So join our dietitian team. That'll be taking place on June 11th for a virtual hangout kicking off the month of June, 5 p.m. Eastern time, just like this evening. And then we've got a couple more segments coming your way on June 12th. This is a double on that day. So in the afternoon, we love to highlight our partnerships with other nonprofit partners and advocates in this space. So we will be joined by Advocates for Community Wellness. This is a nonprofit out of the Chicago area. Regina Hopkins, who is leading the charge, is truly amazing. So she will be sharing the work that they do in Chicago. And for those that are local residents, they'll learn how they can get connected with her. So that will be streaming live on the Unite for Her Facebook page at 1 p.m. Eastern time. So if you're in the Chicago area, be sure to join us. Regina is just amazing, and I'm thrilled to have her with us. And then we'll also be having a speaker series that evening. So at 6 o'clock Eastern time on the 12th, we will be diving back into lymphedema management. So this is a topic that we've covered a few times in the past, but this is a new update. It's been a little while. So I'll be joined by certified lymphedema therapist Dana Torreggiano, beautiful Italian last name, to talk all about lymphedema. So we're really excited to have her. Great topics coming your way, but as always, all of our segments will be viewed on our Unite for Her education library. You can go to uniteforher.org/UFH to view all of that. So with that being said, I know a dreary Pennsylvania, but really glad to be here with all of you this evening. We've got a great turnout. And so I feel like it's time to introduce our amazing expert, our speaker, and I am honored to say Unite for Her provider for this evening. So let me introduce Kevin Hubbard. He is a licensed professional counselor in both Pennsylvania and New Jersey. He attended Temple University for both his bachelor's degree in psychology as well as his master's degree in counseling psychology. He's made it his career to work in communities of color that suffer many injustices, including, but not limited to, access to quality mental and behavioral health care. He believes therapy is a process that promotes exploration and self-discovery, and we all live with internal challenges that may have been caused by external stressors. Sometimes in life, we really need time to set aside, to slow down, look at ourselves, and really attempt to answer the question, who are you? Tonight, we will be slowing down together. So in treatment, Kevin utilizes an eclectic, holistic approach to several therapeutic modalities, many of which he'll be touching on this evening, like cognitive behavioral therapy, solution focused brief therapy, EMDR, mindfulness, and ecotherapy or nature based therapy. So, with that, let me bring on our esteemed guest for this evening. Please join me in our warm welcome, Kevin Hubbard. Thank you so much for being here tonight. We are very excited to be building our toolbox with you.
Yes, very excited to be here and just excited to talk about mental health in general. Any platform I have to talk about the importance of taking care of your mental health is just so important to me. I talk about it all day, literally. So um so I want to kind of just start off with a very basic question for the audience. I like that intro. And oh, go Owls! Yes, yes, I'm a big Owls fan, cherry and white all day. So, let me just ask a general question, and I want you to go into the chat with this in answering it. But I just want to know, how are we feeling today? I heard someone say it was dreary. I saw people from Percy and people from around PA. It's a really rainy day, but how are we feeling? Okay, better. All right. Crappy. Yeah. Great. Tired. Hopeful. Pretty good. Fatigued. Great. Relaxed. Okay. Nervous. Mm. Oh, I'm sure it's chilly in Chicago. Oh, yeah. Anxious. Sad. Hmm. Optimistic. Okay. So if we were playing a game, and we said, hey, if I asked you how you felt and we were playing a game and you said good, I would say you're wrong. Um, Sometimes we get that question confused. We say good, we say okay, we say all right. But when a person asks you, how do you feel? We oftentimes answer with, an adjective or qualifier, and that's actually not an answer to the question. If I asked you how you felt, you might say, well, I feel happy. I feel joyful. I feel sad. I feel overwhelmed. I feel tired. I feel excited. So when we're talking about actually expressing our feelings, this is oftentimes just a normal part of the practice. When we're talking about our mental health and when you're in a therapy session with a therapist and you're just starting out, the first thing they're going to ask you is how you're feeling. So I'm pretty sure that some of us have been in therapy. I myself have been in therapy. I love my therapist. And I do it as a part of not just working through issues, but I do it as a form of self-care. It is so important to be able to use mental health once we've gone through the therapy, once the sessions are done, once we leave the session for that instance. We want to be able to take some things with us. So today I'm going to be talking about our mental health toolbox. And this is something that I feel like everyone can benefit from in some way, shape, or form. It's important to have a toolbox because when we're going through something as difficult or as challenging as cancer, you want to be able to say to yourself, okay, I have tools and I have the right tools in my toolbox to address the things that I need to address as I'm going through these other physical treatments, right? So, first things first, I want to talk about the importance of mental health. I'm just going to read through this quickly, but when you focus on your mental health, you may see many positive effects or impacts, including improved relationships, work output, and your overall well being. It can lead to increased self-esteem and self-confidence, better stress management, and improved physical health. It can also help you feel more in control of your thoughts and emotions, which can lead to more positive experiences and a greater sense of overall happiness and fulfillment. And that's according to embracehealth.com. So when we think about our mental health, we're really just thinking about it from a perspective of, okay, something is wrong, something is not quite right, and I need to talk about it. Or something is happening to me and my feelings are all kind of all over the place. Or I have one feeling that's negative and is predominantly there all the time. So a person can feel depressed and they're just feeling like, I don't want to get out of bed today. I just want to lie here. I just want to kind of just watch television, or I just want to close the shutters and just lay in the dark, or I'm really anxious and I'm worrying about what's going to happen next, whether that's with my treatment or what's going on, and as far as like how I'm feeling from day to day. A person may feel as though just the experience overall of getting a diagnosis is just overwhelming. It can be very traumatizing, and how that information is received and everything. So there's so many things that go along with it. But I will say that your attitude and your perspective in being able to fight against cancer are very, very important. Okay. We may kind of sweep that under the rug a little bit, mainly because our main focus is on our health. It's on, okay, when's my next appointment? When do I need to go see the oncologist? When's my next chemo? When's my next radiation? So those things may be top of mind, but your attitude about those things, your perspective, it needs to be clear, right? And so therapy helps to kind of unpack some of that stuff to be able to really just like put it out and say, you know what? I have every right to feel how I'm feeling right now. I have every right to take ownership for feeling sad. I have every right to feel overwhelmed. That is a natural response to something that is, in fact, overwhelming. Far too often, we don't acknowledge our emotions enough, right? And so when we don't acknowledge them, what happens? They tend to overtake us. So I'm going to be talking about a couple of different ways that I do therapy, but I'm also going to talk about some very specific ones that you may not have ever heard of, that you may not have ever seen. But the goal here is just for you to take away some ideas about how you can begin to address your mental health with the support of a therapist. Okay? So first, I mean, the basic question that I always get, from people, where do I even start when I want to go to therapy? Um, I always say start with doing a little bit of research. There are so many different types of therapists, mental health therapists. Just like there are so many different types of doctors, just like there are so many different types of surgeons. We just want to be very specific in how we address certain things. You may say, I want someone who specializes in depression, but I also want the right kind of depression treatment, right? So we want to know what our options actually are. And so when you research the different therapeutic modalities, you can get a sense of, okay, that would probably be a good fit for me versus, I don't know if I'd want to do that. Some people might say, oh, well, you might be a fan of hypnotherapy and it might be like, I don't think that's going to really help me, right? Versus I might need some CBT that's going to help me give me homework, give me assignments, keep me active during the course of my mental health treatment, right? So the second part of this is finding a therapist. Of course, we have the lovely UFH directory, which lists tons and tons of therapists, and also not just mental health therapists, but you have, the folks who do the oncological massage. You have the folks who do yoga. You have the folks who do Reiki. So there's so many other kinds of practitioners in that directory, not just mental health. But that's where you want to start. Now, let's just say, for the sake of a scenario, let's just say you have your passport squares, you use up all 10 of them. You can always ask your therapist, hey, do you accept my insurance? And 9 times out of 10, they should, right? If they're licensed, they should be accepting some form of insurance. But if you find yourself in a jam and you say, you know what, I need to find someone that actually takes my insurance, you have these other options such as Psychology Today or Grow Therapy. These are platforms online where you can kind of go and find someone, and you can actually search by modality. You can search by experience level. There's so many different filters that you can put in just to find the right person, the right fit for you, right? Third, you want to complete an assessment. Okay. This is the first thing you're going to do when you come into a therapist's office after they ask you how you're feeling. They're going to ask you about 30 to 40 different other questions, but they're going to do what's called a biopsychosocial assessment. And it's all in the name. Bio meaning physical, biological, psycho meaning psychological, and social meaning social, meaning how do you interact with other people. So we go through this litany of questions, and a person coming in for therapy, they might say, well, why is the therapist asking me about my childhood? Why are they asking me about, how did I respond to stress when I was a kid, or how did I do this, or how to, and that information is important because what we know is that history is a good teacher. We're gathering data and we're using it as a way to inform ourselves throughout treatment. So that actually segues nicely into the next step, which is education. If your therapist starts to talk at you, leave, run away. But if they are actually allowing you to ask questions and to be able to have a dialogue, that's a good therapist, right? So the reason I say that is because you want to gain as much education through the process as you can. You want to be able to get your questions answered. What should I expect? How should I be feeling after the first session? How should I be feeling after, 6 sessions or 10 sessions or 20? Does it take that long, right? So you want to be able to have a therapist where they're going to able to ask your answer your questions, and you can ask them questions, and you can also get more information if they decide to say, you know what, you have this diagnosis or that diagnosis. It could be anxiety, it could be, I'm dealing with a low grade depression as a result of hearing about my diagnosis. So any education you can gain, and this is not just strictly through Google. The great thing about doing therapy is that I can be Google just for a little while, right? For my clients, and to be able to answer any questions they have, just so that they're not in the dark about, well, if I'm feeling this way, does this mean that I have depression? Or or if I didn't want to get out of bed the other day, does that mean I have major depressive disorder? No, it just means you didn't want to get out of bed. We've done no assessment, we've done no education, so we can't definitively say anything until we assess, right? But after we've assessed, after we've educated, then we get to treatment. And you want to plan ahead for that part of the process. You want to think about, okay, what's gonna what's gonna work for me? What do I need to address in therapy? What do I want to work on? Sometimes again, you come to therapy and you really don't know what to expect. It's almost like this weird stereotype with therapists when you go to a therapist's office, they're just going to be like these master sages with all the answers, and they're just going to tell you the answer, and give you, the answer to any question you might have, right? And it's like that's just TV. Like that's not how that works at all. Some people say, oh, well, I'm afraid to go to therapy because I feel like I'm just going to sit there on the couch and just cry all day. Well, you might, and that's okay, right? But we have in our minds like this, you know, vision or this schema of like what it's supposed to look like and what it might look like. But by the time we actually get there, we're like, oh, this was actually quite relieving. It was kind of confessional in nature, and now I feel like I got some stuff off on my chest. So when you go into treatment, it's not on the therapist to tell you how to feel, how to think, how to behave. It's on you to figure out, okay, so what are the things that I need to talk about? What are the things that I want to bring to the forefront? And let's look at it together to see what we can glean from how do we want to address this using that modality that we researched in the beginning, right? So, bringing that full circle, this is kind of where we start, right? Now, there's a lot of options. This list is not even close to being a complete list of the different kinds of therapies that a person might choose, right? So of course there's the CBT. That is the most basic form of therapy that anyone anywhere could at any point engage in, right? The reason being is because C stands for cognitive, B stands for behavioral, T stands for therapy. In that context, I'm thinking about my behaviors in the context of therapy. So when we talk about cognitive, it's all about your thoughts. Then the B, it's all about behaviors. We need to bring those two things into alignment so that the therapy is successful. Because how I think should match up with how I feel, right? If I'm thinking positively, I should feel pretty good about that, right? But if I'm thinking negatively and I find myself depressed and I'm exercising that through the behaviors that I have, meaning, I don't want to get out of bed, or like, again, I'm not really motivated to do much. I don't want to be around people. That's kind of a dissonance. So we're not in alignment. You have things like EMDR, SFBT, mindfulness, ecotherapy. I'm going to talk about those first few. But then you have ones like psychoanalysis, right? Or psychoanalytic. This theory is much more long term. You're going to be in therapy for like no less than 2 years. Humanistic, interpersonal therapy. This is more about how we relate to other people. Um, Acceptance and commitment therapy. It's in the name. What are you able to accept? What are you committing to? Dialectical behavioral therapy. That incorporates a lot of mindfulness as well, but just from a different perspective, much more routine and ritualized. Motivational interviewing. That's about more so not focusing on the why, but kind of getting to the who, what, when, where, and how of what you're working through. Sometimes we get into these situations in our life and they could be like really devastating to us, and we say, why? Right? Motivational interviewing, what does that do? It kind of pulls that question out of the way and it says, who, what, when, where, how? Who are you? What's going on? When did you start feeling this way? How are you going to address it? And where did you start to feel this way? So being able to use motivational interviewing is also pretty common with any therapist that you might run into. Exposure therapy. That's like when, a person has a deep, intense fear or anxiety and they are planted front and center in front of that thing. It's almost like a confrontation. I'm going to put myself into that position and, really just focus in and see how my body and my mind tolerates being exposed to the very thing that I'm afraid of. And then, of course, you have things like couples and family therapy. So in that instance, you might, bring your partner or spouse into therapy as a way to support you through what you're going through and to be able to kind of do family sessions. And sometimes that could be really fun. I've always enjoyed couples therapy. It's very, very interesting to me just to see the dynamics and how that can build. And also, it also helps to kind of identify how another person in your life can be a part of your treatment. Because I think we kind of forget like therapy is a very personal process, is a very kind of like confidential process. But at the end of the day, um, more recently, I feel like people are more open about therapy. They're more open about what they've talked to their therapist about. They're more open about their relationship with their therapist. And sometimes we shy away from it, like, oh, I'm not supposed to talk about that. It's therapy. I'm not. And the wonderful part about it is we can be transparent about it because guess what? More people need to go to therapy, right? More people need access. More people need to be able to have a space where they can talk about anything that they want to without being judged, without feeling ashamed, without feeling guilty, and to be able to talk through that with a trained professional. So it's almost like a privilege to be able to even be in therapy because no one in our life is really going to give us that kind of time. No one in our life is really going to give us that kind of space unless they already doing that. But then again, do I want them to know everything? And also, is that person a friend or a family member? And are they going to judge me? Right? Because they have a different stake, right? So we're just privileged to have spaces like this and to have so many different approaches to therapy. And again, you just have to find the right one that fits for you, right? There's EMDR. A lot of people ask me, what in the world is EMDR? I see you going like this, Kevin, and you're moving your finger in front of somebody's face. And what is going on in the brain? What is happening, right? So EMDR is a type of therapy. It is sometimes a brief form of therapy. It can be longer, but it uses this motion, right? I'm going like this. It's called bilateral stimulation. What it's doing is waking up both sides of my brain at the same time. And with that movement, that constant back and forth, I'm only asking the person to follow with their eyes. And as they're doing that, memories start to kind of come up. And as those memories start to come up, the person gets very disturbed because I'm asking them, hey, I need you to focus on this thing for a second. And I really want you to think about that negative or that scary experience. But as we continue to do the processing, we start to kind of notice that the sting from those experiences, the sting from those thoughts, the pain that's associated with it starts to dull, right? This was a type of treatment that started with military veterans, coincidentally enough. It's a trauma treatment. So this is specific to things like PTSD or acute stress disorder. And then the benefits, again, it's about softening the sting of that traumatic memory. And then the individual has a chance to kind of like look at those memories. And then when they think about it, the impact of the pain from that memory isn't as painful, right? And that's what you want to go for. Completing EMDR is like saying, I can think about that really traumatic thing. I can think about it now without crying. That's success when we're talking about EMDR. Or I can think about that thing without my heart racing, or I can think about that thing without my body tensing up. That's what we're doing when we're doing EMDR. It is full on, using your brain to its fullest advantage as well as regaining control of your body at the same time. Solution focused brief therapy. It is all in the name. It's solution focused and it's brief, right? Maybe about 8 sessions at the most. Why is that? So SFBT, as it's called, is it's usually a type of treatment that kind of forces you to focus on the future. It doesn't give you a lot of opportunity to process or start to deal with hypotheticals or start to kind of go into these places where you're starting to think about, oh, well, maybe it could be this or maybe it could be that. It's like, no, what do you want? What is the purpose of you coming to therapy? Because every session you're going to be moving towards the end as quickly as possible. It's a difference in any other form of therapy that I do because oftentimes a person's like, wait, we're already done. I'm like, yeah, we've identified the solution. You are now doing it. If there's like more processing that you need to do, hey, there's things you can do outside of therapy to address that, which we're going to talk about in the toolkit. But being able to address this stuff is really, really important in a very kind of succinct, straightforward way. It leaves very little room for a lot of chatter. Sometimes a person can be in a therapy session for SFBT and they can sit in complete silence and they're just reflecting, right? Or they're just thinking about the solution to their problem. And then they're thinking about all the different scenarios that might come about from making a decision on that problem, right? So it helps a lot with pretty much any mental health disorder, including and not limited to some of the more organic conditions like addiction or things like that are more organic in terms of the brain, things like schizophrenia. It is effective for every single mental health diagnosis, and it also it forces that person to move quickly through treatment. So, what are the benefits? Again, it's quick. It resolves a very specific, targeted issue. It's very intentional. And by the end, the person is empowered to kind of move through that issue and address it head on. There is no, it's almost like I'm just showing you how to do this, and then I'm pulling back each session. I'm getting further away from you while you're getting closer to that issue and getting your hands on it and getting a handle of it so that you can move on from that. Okay. Mindfulness, probably one of my favorites, right? So mindfulness deals with being in the present, right? It deals with being in the moment, right? And so one thing that we have to try to do in the moment is to not judge it and to also not to try to change it, okay? Because oftentimes when a person says, "Oh, well, I practice mindfulness meditation," and I was like, "That's impossible." Because mindfulness is about the present, meditation is about the past, right? And so when they say mindfulness meditation, it's like, okay, so are you going between the past and the present? So if I'm using mindfulness, if that's what we're going to say, I'm using mindfulness, I'm talking about the here and now, right now, how I'm feeling in my body, in my thoughts. And again, if thoughts and ideas pop into my head, I'm just letting them go by. It's almost like being on a train. You're just watching the objects go by. You're not trying to judge it. You're just kind of accepting it. You're just kind of like, oh, that's interesting. Now that I'm aware of it, oh, that's interesting. Oh, that's cool. Like you're just becoming more aware of yourself, how you feel. You're getting more in touch with your emotions. It can take time to get good with mindfulness, but the point of it is to make sure that you get to a place where you're feeling as if you are in control of your own thoughts, feelings, and behaviors, right? In the moment. Because something really, really bad could be happening, but in the moment, you could say, no, I can actually understand the situation fully and completely. I'm not judging it. I'm not trying to change it, but I'm accepting it and I'm moving through it as opposed to avoiding it, as opposed to trying to figure out what is going to be the solution to have a definite answer. It's like, no, we're undefined. We're going to move through it. We're going to take our time. We can sit right here. We don't have to move fast. We can just sit and be more in tune with how we're feeling in this moment. thinking about all the different thoughts, feelings, body sensations that are associated with it, right? So, what is this helpful for? It helps treat depression, anxiety, and trauma, also known as the big three, right? What are the benefits? Well, it certainly helps decrease depression and trauma. I'm sorry, depression and anxiety, but it also has helps us with greater satisfaction in relationships, improve memory and focus, less overthinking. That's a really big important component of mindfulness. Less overthinking or obsessing over certain things, improve resilience to stress, improve the ability to manage emotions. So we want to get to a place where we can manage. That is what mindfulness is all about, and it helps us to get into our bodies, into our minds. And then we have ecotherapy. I'm practicing this right now. I just wrapped up a series with a group of men in Philadelphia in the Wissahickon Valley Park. But ecotherapy, this one really, I don't know why it excites me so much, but it's spring, or we're getting through spring, we're getting ready to hit summer, and we're in this space where it's like the seasons are changing over, and the sun is going to be out more often, even though it's not out right now and it's very cold, right? But as we get into nicer weather, what we also notice is that that also helps with our mood, right? But there's also so many parallels between what's going on outside in nature and what's going on inside of us, right? So in ecotherapy, you are doing a traditional psychotherapy session, but you're also using the metaphors that exist in nature to talk about the things that you're going through. One of my more famous examples that I always talk about in the Unite for Her orientations is when we were in Percy. I saw someone here from Percy, so you might be familiar with the Still Rise Farm, run by Dr. Monique Gary. And so you you go to this farm, and it's just a really big house, and she's got like different little buildings there. And I've always loved going there because I have a chance to do like a little mini hike, and there's certain things that I like to show people on the hike. But there was one instance where we were on this hike, and I had about 20 women with me, and we were walking on this trail, and we came upon this tree, and the tree was like it almost was like so obviously different from all the other trees. It was white. It was just like it almost was like it looked dead, right? It looked like the kind of tree that like it might have got struck by lightning, like we don't know. But it was just like the kind of tree you look at and it's just like, oh, that tree's probably done. Probably maybe we'll chop it down. And I remember being on this hike and I saw this tree and it stuck out so much to me that I ended up stopping the entire group from moving. And I said, we have to stop right here. Let's not be like, I want everyone to just stop and look at that tree. And they're like, okay, Kev, why are we stop? Why are we looking at a tree exactly? What's going on here? So I said, you need to look at this tree. I want you to really look. I said, what do you see? They're like, it's a tree. It's probably dead. It's gotten little to no bark on it. It's probably just a dead tree. And I said, no. I said, look closer. And so they look closer and they look at the ground, and there's all these little like seedlings, there's grass. And then I say, look even closer. And they look at the tree closer and they're like, oh, there's a bug in here. There's like a bug running up the tree. Like, oh, okay. What else do you know? Oh, there's birds on the branches. Okay. What else? And I just kept going like, okay, so is this tree dead? And they're like, well, technically, I guess you could say it's dead. And I was like, but it's very much alive with activity. I was like, so you can't count it out. Just like when you get that news about the diagnosis and you immediately go to the worst case scenario, right? You're very much still in this fight, right? But it may not look like it. Your body may look different. You may look, but at the end of the day, this tree is representative of the life cycle. It's representative of the things we go through. Because guess what? By next summer, that tree is going to be right where it needs to be, right? So every time I go back there to Still Rise From, I always stop by the tree. But nonetheless, ecotherapy is particularly effective for treating things like anxiety, MDD, PTSD, and also adjustment disorder or more generalized stress. It helps to stabilize our emotional state. It helps us improve our focus. Again, it supports and boosts our mood. It also helps to calm down our parasympathetic nervous system. That's the part of your nervous system that you don't have to tell it what to do. It's the part of your nervous system that tells your eyes to blink, tells your tongue to create saliva, tells your heart to beat, tells your body to sweat when it's hot. It's that part of your nervous system, but it helps to calm us down and to bring us kind of to a state of kind of like, okay. Now, another thing I'll say about ecotherapy is that when we're outdoors, and this is so important, if you didn't hear anything else I said all this whole presentation, hear this. Trees, grass, any green, like nature, anything in nature that is green in color, it has in it something called phytoncides. There's certain types of trees that have more, like pine trees. But you've ever mowed the lawn and you smell that smell of the grass, right? Phytoncides, unlike pesticides, pesticides kill. Phytoncides actually, when we breathe them in, it's a chemical that they give off. And when we breathe it in, we're actually breathing in these phytoncides. And what do phytoncides do? They boost our NK cells. And what are NK cells? So NK cells are known as natural killer cells. Natural killer cells are a specific type of white blood cell, and those white blood cells specifically kill something inside of the body when it's not supposed to be there, such as tumors and cancer. So when we're talking about being out in nature, I cannot emphasize this enough. We are in it is what's today? May 28th, right? It is Mental Health Awareness Month. We are wrapping it up and the weather is going to get nicer. It's going to get lovely at some point. I need every one of us to make it a point to go outside. Go outside, spend time in nature. It is healing. There are so many properties to it, and you don't have to spend a very long time either. You can be out there for 10, 15 minutes. I just need to go outside and take some deep breaths in, get it in my body, right? Accept and just bring in as much of those fighting sides as I can so that I can get myself, to a better place. And again, this just helps so much with our mental stability too. Because of these other benefits, I just tell people to go outside. I don't even tell them about the fighting sides. I just say, hey, go outside. Just spend some time, take a break, get yourself outdoors, and make sure that you do it early. Make sure you do it often, um, and make sure it's a consistent part of your day to day. Okay. All right. So now we get into the tools in the tool belt. I want to talk about these and then I'm going to open it up a little bit. But tools in the tool belt to fight cancer from the inside out. So I talked about the fighting sides. I was so excited I got ahead of myself. So spend time in nature, right? Um, Also, you need to get a journal. A journal is a very powerful tool when we're talking about protecting and maintaining our mental health through this process. If you don't have a journal, you could just go get a notebook, dollar store. Just do not complicate it, okay? A journal can be what you make it. A journal is a very personalized process. It is literally just the act of writing down your thoughts, the things that you're thankful for, the things that you're grateful for, being able to talk about the things that you wouldn't talk about with anyone else, being able to get your frustrations out, getting those weighty thoughts out of your head, just being able to have a space to put it. You don't have to be a nominated, a writer or a Nobel Peace Prize winner or anything like that. You just need to write. And the whole point of it is to expel, to purge negative thoughts so that we can also include and put in more positive ideas about how we're going to fight this thing called cancer. So make a point of writing. Walking and hiking, that kind of coincides with the ecotherapy. Rest is resistance. Rest is resistance. I hear that a lot nowadays, but it's important to kind of think about, okay, I'm going to go against the grain and I'm going to rest because we live in a society that is very much opposed to rest. We live in a place that is very much opposed to, sitting down or taking a break. It's like we're always on go, 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 right? But it's so important to take your time, take a rest. And I mean intentional rest, the kind of rest that no one can take away from you. It's the kind of rest where when you sit down and someone says, hey, we got to go do that thing, it's like, nope, we're not doing it. I'm going to stay right here because I'm too comfortable, right? So make it a point to rest. Make it a point to spend time with loved ones. That's very, very important. You need to have a constellation of support. That phrase, constellation of support, I think of like the stars. Your constellation, think of it this way. If you're a planet, if you're planet Earth, the further away you go, there are these stars and they form constellations. Some stars are close, some stars are extremely far away. But whoever is in your immediate solar system, those are the people that are going to be closest to you during this fight. Those that are furthest away, those might be some of the other folks that are in your circle of support. It could be the oncologist, it could be the doctors, it could be your PCP, it could be your therapist. So just think of making sure that you have a constellation of people around you that are caring for you as you go through this process. Creating a safe, calm place. That's the EMDR technique. This particular technique entails being able to cultivate or formulate a safe, calm place in our mind's eye. It takes time to cultivate it. Sometimes it's from a memory. For me, it's being in my grandma's backyard, and she had a giant apple tree, and we would go out in the backyard and we would go out with our baskets and we would pick up all these apples, fill up these baskets, so much so to the point where we couldn't even lift the baskets. We would take them in the house and she would create apple pies, apple cakes, and she fresh off the tree. The best, one of the best memories that I can think of just off the top of my head. But that essentially is a safe, calm place, right? It's a memory that's associated with a positive experience. So, in experiencing EMDR, when you're going through it, you might get these really intense moments of trauma and fear, but then you get to decide, okay, I'm going to go to my safe, calm place. And you can do that in your mind's eye. So, if we could all make it a practice to think of what is that one memory in my lifespan that is just so soothing and so calming that I can pull up into my recall, that by itself is a tool, right? I don't want to say it's the ultimate tool, but it's a very powerful tool nonetheless. Um, Reflect on the things in your life that are going well. You know, this is not a pity party, right? This is about being in the fight, being in aware of what has to happen and being aware of what needs to move forward, right? But also being confident and courageous and brave as you're going through that fight. It is not lost on us that when we're reflecting on all the different parts of our life, we might get to these dark places. Oh, did I do something wrong? Was there something that I did that caused this, or was there something that made this happen? No, because the moment that you start to blame yourself, or the moment that you start to, internalize and all those negative emotions, then you end up allowing those negative thoughts, negative feelings to overwhelm your narrative. You want to write a different narrative, right? So we reflect on those things in our life that are going well, those things that are positive. Some more tools. Let's make sure that we make it a habit to meditate regularly. Meditate, which means to reflect, right? Let's make sure that we think about the things that we've already been through. Let's plan for it. Like think about what we want to gain from these past experiences, and then we can do some mindfulness. Think about what we're going through in the present moment. And then we can go to the third step, which is the future, which is manifestation. Think about the things that you want to have happen, right? So we can go through all different forms of meditation, mindfulness, manifestation, and making sure we're concerning ourselves with our past, our present, and especially our future. Use your breath, okay, to regain your sense of control. Sometimes we get so overwhelmed we can't even breathe, right? We get so anxious we can't even think. But your breath is one of those things that you can instantly allow yourself to grab and then to hold on to, right? And then when you're breathing in deeply, especially through your nose and out through your mouth, it is allowing blood and oxygen to get to your brain quicker so that you have a better clarity of thought and you have a better presence of mind. Because a lot of times, what happens when someone gets angry or upset? They say, "Yeah, go take a hike." There's a reason for that. It's an old saying, but there's actually a reason to say, "Hey, go take a hike." It means you're going to go outside and you're going to walk and you're probably going to breathe, right? But making sure that you're doing that is so vitally important. Don't forget to breathe, even in those challenging moments. Engage in radical forgiveness. We hold on to a lot of stuff, and sometimes it's this is a tool, but it's almost a tool that helps me to get rid of some things. If there are things, people in our lives that have disappointed us, people in our lives that we thought were supportive, but they're not, people who are, we're hoping that they're going to be more present during our treatment, but they're not. We need to be able to engage in radical forgiveness. Everyone has something, right? But we have to forgive. We can't hold on to negative feelings. We can't hold on to negative thoughts, particularly about other people. We have to allow ourselves to move through this process because it's a very personal process, and we want to be able to do what we need to do as we're working through it. Positive affirmations, another really good tool. There's three parts to positive affirmations. You say it, you think about it, and you live it. That's what an affirmation should be. When you say an affirmation like "I am worthy," I am worthy. Now think about, what does that mean? I'm worthy. Well, I'm worthy of love. I'm worthy of care. I'm worthy of all those things. And then you might say to yourself, well, how do I live being worthy? Well, I'm going to move throughout my life with conviction. I'm going to move with authority. I'm going to move with worth. I'm not going to let anyone or anything diminish how I feel about myself as I'm going through this process, right? Use art as a form of self-expression. Art is a very powerful tool. Making sure that, look, you don't have to be Picasso. You can pull out a pen and paper and just start doodling. It does not have to be anything special, but just allow yourself to be expressive. In art, we're not just talking about painting, but there's so many mediums of art. There's singing, there's dancing, there's paint, there's colored pencils, doing those coloring pages, those therapeutic coloring pages. There's poetry, using every single modality that we can in terms of art to express ourselves and how we're feeling, right? It's a very wonderful tool, and it's a very wonderful way of expressing yourself as you're going through this fight. And then also make sure that you don't stop setting goals, short and long term. Life is not defined by that diagnosis. It is not, because you were a person before that diagnosis and you're still a person with that diagnosis. So don't get it confused. Life is not defined by a diagnosis, right? And then we have to get to this last one. What are you doing for your self care right now? You have to be very, very vigilant when it comes to your self care, whether we're talking about your diet, whether we're talking about physical movement and exercise, whether we're talking about getting outdoors more, like I just ranted about, right? But making sure that self care is a built in part of your process. Therapists, we probably spend about 90% of our time psychoeducating about self care because people have gotten so far away from taking good quality care of themselves on a consistent basis. And that's for a lot of reasons. That's because of things like our jobs. That's because of our families. If you have kids, you have other things to worry about sometimes. But we have to make it a priority each and every day to implement something by way of self-care. It could be something as simple as, I'm going to go to sleep early tonight, right? I'm exhausted. Or I had chemo the day before. I'm tired and I don't want to really be bothered. I'm going to go rest. Like making sure that you take care of yourself and being gentle with yourself, being very kind to yourself, being self-compassionate. Because sometimes, I mean, let's be honest, we don't live in the most forgiving society. We have to be kind to ourselves because we can't expect it to come from outside. We can't always expect it to come from some other person. We have to be kind to ourselves as we're going through this really challenging thing, right? So, that being said, I, I am open to questions. I talked a bit. I didn't know it was going to be that long. But we're at 5:52. This is a game I like to play called Ask a Therapist Anything. Um,
That was wonderful and
yeah.
prompted a lot of engagement in the chat and sharing
Ah,
um and just like a lot of dialogue, which is really wonderful. So I wanted to call out a few questions. I think a lot of this, um some really good thoughts. First and foremost, earlier in the chat, Marianne had made a note, which I think
mhm.
was um a really good question and prompt. She said, how do we know what to work on for ourselves? Sometimes it's hard to see the forest through the trees. I think, wow, like, right, what
Mhm.
if you're so overwhelmed that when we're trying to figure out what to talk with our therapist, we don't even know where
That's
to start? Where do we
yeah.
begin?
That's really good because I talk about this in orientation. So,
Yeah.
so sometimes there's so many things to talk about, but we prioritize based on what we would call the 8 dimensions of wellness. So remember, you've seen it before, Aaron. Eh,
Hmm.
When I go through that, what that actually is helping with is to prioritize each of those 8 things at any given point. So I might say, today I'm going to work on my physical dimension or my physical wellness. I'm going to work on my social wellness tomorrow because I'm going to go visit some friends, and then I'm going to work on my financial because I, just got paid and I want to make sure I put some money in my savings or something like that. So there can be so many things to work on, but let's say if you just had 8, that's pretty manageable considering this model, the 8 dimensions of wellness, is actually comes from a doctor from Rutgers University, Dr. Swarbrick, and she created it because there were people who were going through addiction, and what they found was they needed a way to simplify their lives as they were coming out of rehab. So what we found was this was actually really useful for just day-to-day life, right? Like simplifying things so that I can just have like priorities kind of set in order and I can take my time. I don't have to rush. I can focus on one thing today. I can focus on something tomorrow. And again, what I said at the end there, being kind to yourself, being very self-compassionate, not moving too fast. Like, you know, I want to actually, slow down and actually appreciate the forest and the trees, right? So
Yeah.
I can
Yeah.
look at all these issues and just say, it's going to be a challenge, but I'm going to move through it and I'm just going to do a little bit here, do a little bit over here, sweep a corner here, like you don't have to rush through, but allow yourself to check out that model. The 8 dimensions is really, really good and something that I do cover whenever we do orientations with UFH.
Yeah, I love that. I love that.
Mhm.
And I love the reminder of you don't have to tackle everything at once, right?
Not at all.
It's
Not at all.
yeah. Another question that came up when you were reviewing the mindfulness, mentioning being emotionally regulating, is
Mhm.
that something specific to mindfulness? Do all of the different types of therapies that you touch on in some way, do they help with emotional regulating as well?
No. So more
Okay.
specifically,
Yeah.
I can say things like EMDR, for example. That is not
Hmm.
an emotion regulator. That is an emotional trigger. So if you did EMDR, you'd probably spend much of your time actually stressed and then having to go to your safe calm place to bring you back to center. So oftentimes with mindfulness, that's like a good activity to engage in after you've done an EMDR session. EMDR sessions are emotionally exhausting. Okay, I've done EMDR before. It is intense. And
Yeah.
sometimes you can spend so much time just crying, to be honest, and you're just like tired at the end. But it feels good. It's like something that's like liberating about it. Like I've cried so much, like I don't even have any liquid left in my body. But it's one of
Wow.
those things where it's not a calming feeling, but on the other side, on the back end, mindfulness is a good, I guess you could say, supplement that you can take or that you can try out as a way to make sure that you come back to center and that you can bring down that nervous system to kind of get more regulated with your body and with your mood.
Yeah, I love that. And Barbara said is that could be, I would imagine, is that why my counselor stopped it for now? EMDR too dangerous, maybe too
Yes,
emotionally.
there's a there's phases to it. Yes, it can be too intense for some people because some people
Yeah,
you have to be prepared. There's months of preparation actually. EMDR isn't something you just go try. It's not
yeah,
like the other, it's unlike the other models that I talked about because it can take months just to get through phase one, which is just the history. If I find
yeah,
in this person's history that they have a stress response that actually forces them to go and use a drug that they might have been addicted to in the past. I'm not doing EMDR because I don't want to
yeah.
trigger them back into addiction. So you have to
Wow.
be very careful. It's like doing surgery, but you have to use the right tools and then you have to stitch the person back up each and every time you do a session because you're opening them up every single time emotionally and then you're having to gently close them up and, put that dressing on, as they say.
Wow, 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 wow. Well, and I guess you bring up a good point. We had an attendee make a comment of just, not every outlet or not every therapy is good for everyone. Something
Yes.
like writing or a tool that you mentioned may
Hmm.
not be helpful to all of us. So I think just knowing or being aware or working with a professional that may be able to identify some of
Hmm.
those tools that can be helpful, but knowing not
Yes.
everything is for everyone.
Yes, and when you get to therapy, that's something that you want to learn about from your therapist, or even just talk to your therapist through that beginning part, that biopsychosocial, because you're giving
Yeah.
them a lot of information. And I'm at the same time writing down, okay, Erin doesn't like this, but she really likes this, and I'm creating those preferences, right? So I don't want to assume that any of these tools are going to be the tool for you. Because once you get in front of a therapist, there's going to be something that's not on this list. There's going to be something that we didn't talk about. I didn't even get into like animal assisted therapy or anything like that. Like there's so many other things that people can do as a way to work through their mental health challenges.
Yeah, I love that. Couple great questions that just came in. The best tool to shift out of negative thinking. I love that
Mm,
question.
that's a loaded question. There's so many things that I think can help with shifting our mood. I would say that anything. Now, this is strictly my opinion. I'm going to give this because I think that this is true because I've seen it happen. But I think that anything that actually allows you to be active. So if you're kind of just sitting and thinking like what mindfulness or meditation requires, that might not always be the best way to shift your thinking. For a person who enjoys moving or walking, or they just some people get happy when they clean up their space. They're like, oh, I feel better. There's certain things that will help when you're active versus when you're more sedentary and having to be just sitting there with those thoughts just cycling through. So sometimes you might want to break that cycle with actual activity versus sitting with the thoughts if you're not prepared to really work through in that way. So there's different ways of approaching that, but you just have to make sure that you're giving yourself a little bit of grace and space to learn about yourself and see what works for you. Yeah.
Wow. Yeah, I love that. That that sounds really, yeah, that resonates.
Mhm.
I'm like, oh my gosh, I can see how that would make sense. Okay. Best tools for chronic depression, ecotherapy, amazing. Any particular time of day that you recommend, or just what would you lean into? I know you mentioned a couple of the therapies that are good for anxiety, depression, that sort of thing. Anything else?
Yeah, so I mean, like CBT definitely comes to mind. CBT again, it's a more basic form, but what CBT is doing is it's trying to bring your thoughts in alignment with your behavior. So for a very anxious person, a person who might like have certain triggers, their heart might beat really fast, or they might have sweat, cold sweats, hot sweats, they're shaky. That might be better for someone who's going through something like anxiety. Whereas like with ecotherapy that can also be helpful, but you have to almost like prepare for it because it is a physical activity. I don't want to do a physical activity and I'm already having somatic symptoms that are like exerting me, right? I may not want to necessarily go on a hike right after having a panic attack of some sort. So it's important to take care of yourself in a way that allows for you to be flexible. It shouldn't be where you go into therapy and the expectation is this therapist is going to tell me something and it's going to fix me right now. No, it takes time to learn about what works for you, and you have to be intentional. You have to share, you have to talk about what you physically, emotionally, and mentally go through so that the therapist has the best understanding of that issue so that they know how to support. It should never be where, oh, there's this thing that I can do and then snap my fingers, I'm better. There's so many things that help with depression. Conversely, like we might say, okay, well, the journaling might not work for person A, but on the other side, they may really like art, right? I'm still doing something where I'm sitting and doing, but I'm being very intentional about what helps me, right? And that's one
Hmm.
thing that I want to push for is like that self advocacy that happens even when you're with your doctor, making sure that you're also advocating for yourself when you're with your therapist. This is what I like, this is what I don't like, these are the things that I enjoy, these are the things I care about, et cetera, et cetera. So
I love that. Okay. Two more quick questions. I know we're a little over time, Kevin. If that's okay, I just want to touch on a couple quick things.
yeah, yeah.
Grounding techniques for panic attacks. You talked a little bit just
Yeah.
about this sort of right with those sort of somatic feelings. So,
Mhm.
any suggestions for grounding techniques?
Yes, and I'll start with like what is a panic attack? Because a panic attack can be very destabilizing for any person at any point in time. If you've ever and hopefully you haven't, but if anyone on the call has ever experienced a panic attack, it can be one of the most um it can be one of the scariest experiences ever. because it almost feels like you are losing control of your body in a way. It's like I can't control my breath, I can't control my thoughts, and I can't control my ability to kind of like calm myself down. And I'm on a 10, but I'm trying to bring myself down to a 1 or a 0, and I can't physically do that in the moment. But the best way to prevent a panic attack is to understand what's happening somatically. So sometimes people have panic attacks and there's absolutely no known cause, right? On the other hand, there are people who have panic attacks and there are ways of working through it in the moment. And remember what I said about the breath. If my thoughts are racing, I need clarity of thought. I need to get oxygen to the right places. I need to get blood to the right places. So if you know, or you can anticipate, or you almost feel it coming, it's like I need to be able to gain control or try to get in front of it before it has an opportunity to get worse. It can get really bad, but one thing you have to try to rely on as you're grounding is your breath. Now, some people might say, oh, well, maybe I'll just get up and go outside. No, no, no. You can sit right where you are as long as you're not in a place where there's like, a ton of people watching you or something. But, sometimes a person can have a panic attack and they could just be sitting still and just close your eyes. It's almost like sensory overload. So the first thing I would do is I would close my eyes. I need to kind of start to kind of fine tune or almost like turn the volume down. So I'm using all five of my senses. I'm gonna close my eyes. I'm going to breathe slow and deliberate. I'm going to try to focus in on the sound of my breath as opposed to focusing on, some other thing that's triggering me. And then I'm just going to let my thoughts play, almost like a tape. I'm just going to wait for it to finish and then I'm going to stop it and then I'm going to allow my body to come back to center. The I don't want to I don't want to overstate this, but the power of the breath, it's so important because we don't breathe. Like I know it's weird to say, but we don't breathe. Like we sometimes go through so many different things and we forget in that moment to breathe. So use the breath, use other supplements like nature, use other supplements like movement when it's appropriate to do so. I think one of the more powerful tools, and I didn't talk about this because it's not necessarily in my purview, but one of the things that I know that UFH offers is yoga. So if you go into any kind of body work, that is allowing your body to feel more in control and more, you can feel more autonomous as you're moving your body. There's a really good book. I recommend everybody read it. It's called The Body Keeps the Score. It will explain this in way more detail about how to deal with trauma and things of that nature and how the body can be used as the tool to deal with it.
Amazing. Right. And there's a lot of chiming in about the power of breath, especially with those
Mm,
emotions with panic attacks. And I
mhm,
appreciate all of the sharing for sure.
mhm.
One final question, just in terms of clarity. Did I lose it? Just in terms of licensing. Oh, licensed clinical social worker. Okay. Do they have to be a psychologist for someone looking for a mental health professional? Can you
Yeah.
shed a little bit of clarity on that?
Yeah, so we compete, we all compete for the same jobs. Psychologists, LCSWs, LPCs like myself, we all compete for the same jobs. The difference is the level of schooling that that person had. So if you're going to a psychologist or what they call a PsyD or psychological doctorate, you're going to a person who has a doctorate degree. If you're going to an LPC, if you're going to an LCSW, an LMFT, they have some new licenses out now that I'm not really familiar with. But when you're going to one of those L's, you are going to a person with at no less than a master's degree, right? The difference between psychologists and some of the L's is that the amount of schooling, but also sometimes psychologists have to get that extra added credential of the LPC or the LMFT or LCSW because they are not typically just licensed right off the bat. They have to also go and acquire their own license, and they have their own process for that that allows them to get through that process and start to be able to work with folks, but particularly for the purposes of insurance. The credential also just allows for like a higher reimbursement and pay for different types of professionals, depending on the population you're treating. So it gets very
Okay,
technical, but for the most part, they are. I would work with an LCSW, and I'd be very comfortable working with a psychologist as well.
perfect. I love that.
Mhm.
Oh, thank you, thank you, thank you. This was wonderful, super informative. Love the lists of the toolbox and just kind of bringing to light, some of those accompanying things that we can do to help us as we're working with a mental health professional. This was wonderful, Kevin. Thank you so much.
Thank you. And I see the thanks coming in. So thank you all for just listening to my rant. So I hope everyone enjoys themselves and enjoy the rest of Mental Health Awareness Month. There's typically a lot going on at the end of the month. So if you have any space or time to get outdoors this weekend, try to do so. And just treat yourself to some good mental health and wellness.
I love that. Thank you. All right. So I will wrap us up for this evening. All right. Wonderful. So, again, I want to thank everyone for being here. Thank you for chiming in and for sharing in this vulnerable space. We know mental health and sort of what we're experiencing cannot be, pardon me, an easy discussion. So, I appreciate all of you sharing and engaging with one another. I want to give one final thanks again to our education sponsors. Tonight's virtual hangout was presented by West, Merck, Lilly, Novartis, and Gilead Sciences. We have additional support from Pfizer, GSK, and Daiichi Sankyo. And we've got additional support from AbbVie, Agendia, and Tercera Therapeutics. So we are all in it to support one another. I am so grateful to have experts and providers like Kevin sharing, their knowledge and information with our community. So if you want to come back and re-listen or rewatch or see his slides, they will be available on our video library. But with that, I will conclude our virtual hangout. Hopefully, I will see you at our segments we have coming up in June. Enjoy the rest of Mental Health Awareness Month. And I will see everyone again. Everyone stay safe and healthy. Thanks so much.